One of my favorites, Dr. Zach is back. Zach Levine, of course, a physician at the MUHC. By the way, drzach.ca for more information there. Is here to talk to us about inflammation and disease and how inflammation can, be more than just a passing thing, but really a sign of something going on in your body. Zach, how are you doing?
I'm good, thank you.
Okay, so when we mean inflammation, what's the difference between sort of like, okay, I feel a bit bloated versus actual inflammation? How would you define inflammation to start?
So, inflammation is like many things in the body. It's a vital process that the body uses. It's part of the immune system to fight off either if you have an injury or if you have like a foreign invader. The body mobilizes forces and it brings these inflammatory cells and cytokines and chemicals to fight. So basically, if you have if you injure your wrist, for example, it gets red, it gets swollen, it gets warm, it gets painful.
That's swelling.
Yeah, exactly. But most of that, or a lot of that, is inflammation because the body's bringing things in to try and heal it.
So it should be a good thing after an injury or after something going wrong.
So most of the time, we need it. It's an essential part of the immune system to fight off bad things and to heal things that are injured. So yes, inflammation generally, acutely, is a good thing. The problem is, like many of these things, when it goes awry or when the body starts getting inflammation that it doesn't need, so it starts attacking things that are actually not other.
Okay.
So
when would it start to get like inflammation that it doesn't need? I was just telling you that women often will get bloated. We fluctuate all the time, and how do we know that if it's not hormonal and it's like a problem? That's a very sort of dangerous area for women because we don't know what's going on.
Exactly, and that's the problem. It's obvious. It's not obvious. A lot of the time, it's not obvious. So we were talking about things like ovarian cancer and endometrial cancer that it doesn't have the clear signs, and that's why we were talking about Dr. Lucy Gilbert and how these things are these things are picked up late because there aren't clear signs. So as opposed to if you have an inflammatory reaction in a joint, and so by the way, something like rheumatoid arthritis is an inflammatory reaction in a joint where you don't actually have a bad thing happening. So you're getting all this inflammation, but you didn't have an injury and you don't need the inflammation. And so what we end up doing is trying to suppress the inflammation. So we give anti-inflammatory medications, either non-steroidal or even steroids to decrease inflammation.
Okay.
And so that's a problem. There's a number of those conditions that are autoimmune disorders, and there's a whole rheumatology.
So where the body sends the sort of instinct to protect and to fight when it shouldn't be sending
like lupus, like rheumatoid arthritis, like MS, like inflammatory bowel disease, and those are acute things. And then a whole other issue is sort of chronic, underlying, simmering inflammation. And the problem with that is, as opposed to with arthritis, that you actually feel it. Chronic simmering inflammation we don't even have symptoms of most of the time, so we don't even know.
So what do you do with something like that? You always know that person who's like, I'm bloated, I'm this, I'm that. What do you do with it? How do you treat something like that? Is it like a diet thing or not really? Because is it?
Well, yes, that's one of the things. So right now, for chronic inflammation, the problem with chronic inflammation, and what we're learning is that it's associated with all these things like heart disease, like stroke, like Alzheimer's disease.
Alzheimer's?
Yeah, there's evidence like certain cancers. So there's a lot of things, and the problem is we don't necessarily have symptoms.
You're scaring me now.
Yeah,
but
sorry.
We're not trying to scare you. This is good information.
And it's kind of cutting edge. So that's the problem is we don't know that much yet.
Okay.
But we're learning. Like last time we were here, I talked about like certain bacteria that are associated with diseases, and now we're learning that inflammation, which is generally a good thing, can actually be a bad thing too.
Okay.
And the problem is it's asymptomatic. There are tests for it. So there are blood tests. There's something called a CRP. There's something called ESR that are very general tests to show if your inflammation levels are high. But as of now,
but how would you know that it's like an actual problem? You said chronic inflammation. Like, is it every day? Is it once a week? Like, when should you see your doctor about this?
Well, if you're having chronic symptoms of anything that is not normal for you, then it's worth seeing your doctor.
Yeah.
That's a blanket statement.
It is a blanket statement, Zach, because you're going to go see your doctor, and the doctor will be like, well, maybe change your diet, maybe this and that.
Yeah.
So, like, how do you get your physician to take it seriously, and how do you know to take it seriously yourself? Like, is there a marker?
Well, that's the problem. Most of the time, this is asymptomatic. There's a marker, but the marker I'm talking about is the blood test that I'm talking about.
Which you're only going to get if you take it seriously yourself, and then your doctor takes it seriously.
And by the way, the treatments, like you were asking, like what do you do if you do feel that you have, the treatments are basically lifestyle things. So we talked about diet, we talked about exercise, we talked about, well, we didn't talk about, but sleep is a big one.
Well, then I'm
you
destroyed.
And me both.
2 small kids and early wake-ups.
So if you're staying up all night, if you can avoid staying up all night, avoid it.
We're not partying, by the way. We're getting up early. We should tell people this. But diet, just though, very quickly, because we're running out of time, what should we be paying attention to?
You want to avoid things that we know are bad.
Salt.
So salt, but especially like sugar, like refined sugars, red meat. Moderation for things like red meat, fried things like we all know,
all the
donuts
delicious
and French
things?
fries. Well, we're talking, yes, generally yes, but you know, in moderation. It's not like you can't have none of them.
Yeah.
And then avoid or have the things that are good for you. So we know olive oil.
Yes.
We know like fatty fishes. We know like certain green leafy vegetables
Dark
like
greens,
kale.
no?
Yeah,
Yeah.
exactly. Certain nuts like almonds and walnuts are good for you.
And alcohol in moderation, or not
Alcohol
at all?
no, in moderation it's
Okay.
fine. And certain fruits too, strawberries, blueberries have been shown to have
The berry family.
yeah.
Is that because of the antioxidants, or am I just guessing from a commercial?
No,
that I
you're
saw?
good. You're good. Absolutely. Absolutely.
Okay, and again, all of this, of course, go and consult your physician, Dr.
Yes.
Zach, by the way. Head on over to our website. All of his notes are there, all the extra information. Dr. Zach Levine, the superstar over there at the MUHC. Thank you so much for joining us.
Thank you.
Now get to work.